Section 1. The Unseen Battle. Understanding Schizophrenia. Schizophrenia is a serious mental illness that requires our attention and understanding. It affects how a person thinks, feels, and behaves. It's often misunderstood and stigmatized. This can make it hard for those affected and their families, creating a challenging environment. Imagine a world where your thoughts and feelings are constantly jumbled and unclear. You see and hear things that aren't real, making everyday life a struggle. It's a daily struggle for those with schizophrenia, affecting their ability to function. This essay will explore schizophrenia's impact on families and their dynamics. We'll share insights, coping strategies, and ways to reduce stigma and misconceptions. By understanding this condition, we can support those who need it most. Remember, knowledge is power and empathy is key. Let's shed light on schizophrenia together, fostering a more compassionate world.
Section 2. A Sister's Struggle, a Personal Story. My sister's diagnosis with schizophrenia was life-changing for all of us. Her once vibrant personality became overshadowed by the illness, changing her in ways we never imagined. She withdrew from us, lost in a world we couldn't understand, a world filled with fear and confusion. The hallucinations were terrifying for her, making everyday life a constant battle. She'd see shadows lurking, hear voices whispering threats, and it broke our hearts to see her suffer. It was heartbreaking to witness her fear and confusion, knowing we couldn't take it away. Our family struggled to cope with the new reality. We felt helpless, unsure how to help her, often feeling overwhelmed by the situation. We learned to navigate her delusions with patience and empathy, finding ways to support her. This took time and understanding, but we never gave up. Her journey taught us the importance of support and compassion, and the power of family unity. It highlighted the urgent need for greater awareness and understanding of schizophrenia, and the importance of mental health advocacy.
Section 3. Decoding Schizophrenia. Expert Insights. Experts believe schizophrenia results from a complex interplay of genetic and environmental factors. These can disrupt brain chemistry and function. Research suggests that imbalances in neurotransmitters like dopamine and glutamate play a role. Environmental factors, such as childhood trauma or drug abuse, can also increase the risk. Schizophrenia is not a single disorder, but a spectrum. Symptoms and severity can vary greatly from person to person. Early detection and treatment are crucial for managing symptoms and improving quality of life. Section 4. Recognizing the signs, symptoms of schizophrenia. Schizophrenia manifests in a variety of ways, making it a complex condition to understand. It can be difficult to diagnose due to its overlapping symptoms with other disorders. Hallucinations are a common symptom, often causing significant distress. These can involve seeing, hearing, smelling, tasting, or feeling things that aren't real, leading to confusion. Delusions are strongly held beliefs that are not based in reality, often defying logic. These can be persecutory, grandiose, or bizarre in nature, affecting daily life. Disorganized thinking and speech are also characteristic of schizophrenia, making conversations challenging. Thoughts may race or jump between unrelated topics, making communication difficult and fragmented. Negative symptoms, such as apathy, social withdrawal, and lack of motivation, are also common and impactful. These can be mistaken for depression or other mental health issues, complicating the diagnosis further.
Section 5. Speaking the Unspoken Communication Strategies. Communication is key when supporting a family member with schizophrenia. Patience and understanding are paramount. Avoid arguing about their delusions. Instead, acknowledge their feelings and gently steer the conversation back to reality. Use clear and concise language. Avoid using figures of speech or sarcasm, as these can be misinterpreted. Focus on listening and validating their experiences. Let them know that you're there for them and that you care. Encourage them to express their thoughts and feelings. Create a safe space where they feel comfortable sharing without judgment.
Section 6. Navigating the journey, support and treatment.